Hello everyone, my name is Dr. Ersin Köseoglu from Koç University Hospital, Istanbul, Turkey. Today I'm going to present you our abstract entitled Urinary Retention After Non-Urological Surgeries, Management Patterns and Predictors of Prognosis. We have no disclosures. Incidence of urinary retention after non-urological surgeries remained unknown. The incidence rates range between 2 to 78% in the literature. Predictors and prognosers are not truly investigated. The aim of our study is to evaluate how urinary retention after non-urological surgery is being managed and to determine the predictors of prognosis. Our study has a retrospective design. Patients with urinary retention after non-urological surgery who were referred to our functional urology division between December 2014 and March 2021 were included. Demographical and surgical data of the patients with comorbidities were recorded. In all patients, urethral catheter was kept in situ for at least 5 to 7 days after urinary retention. In males, treatment with an alpha blocker was initiated. In case of a failure to regain spontaneous micturition, clean intermittent catheterization was initiated. In the first month follow-up visit, urodynamic study was recommended if the patient's post-void residual urine volume was above 150 milliliters. A total of 82 patients were included. The median age was 65. The median operative duration was 180 minutes. The median follow-up duration was 31 months. In Group 1, there were 65 patients. These patients had spontaneous micturition after conservative management. Group 2 had 17 patients who failed to gain spontaneous micturition. After a median follow-up of 31 months, only 4 patients stopped doing clean intermittent catheterization and endorsed return of spontaneous micturition. Despite being recommended to 17 patients, urodynamic study could be performed only in 5. Pressure flow study revealed Detrusor underactivity in all these 5 patients. In our study, the majority of patients had urinary retention after general surgical procedures. In the long term, 4 patients stopped doing clean intermittent catheterization and endorsed return of spontaneous micturition. 75% of these 4 patients had colectomy due to colon cancer, and 1 patient had spinal surgery. There were no statistically significant differences between the groups in terms of age, presence of hypertension or diabetes mellitus, body mass index, duration of surgery, the amount of fluid administration, position at operation, type of anesthesia, or presence of patient-controlled anesthesia. In our series, 42.1% of female patients required clean intermittent catheterization, while in males, this rate was 14.2%. Rates of epidural anesthesia and patient-controlled anesthesia were higher in Group 2. Of note, diabetes mellitus was higher in patients who spontaneously micturated after conservative management than who needed long-term clean intermittent catheterization. Our results revealed that spontaneous micturition returned in 79.2% of the patients only with conservative management, which is higher than literature. Female gender was the only statistically significant poor prognostic factor. During a median 31 months of follow-up duration, 4 patients regained spontaneous micturition after initiation of clean intermittent catheterization. These 4 patients had no statistically significant differences among their demographical and clinical data. All of these 4 patients regained spontaneous micturition within 1 year. No spontaneous micturition was observed after 1 year. The strengths of our study are relatively good sample size and long follow-up period compared to the literature. The limitations of our study are its retrospective design, heterogeneous patient population, and lack of urodynamic study. In conclusion, majority of the patients regained spontaneous micturition with conservative management only. without requiring invasive diagnostic tests or therapeutic interventions. Female gender was the only significant poor prognostic factor in our study. Although not statistically significant, colectomy due to malignancy, epidural anesthesia, and patient-controlled anesthesia had negative influences on resolution of urinary retention after non-urological surgeries. Within 1 year, 4 of 17 patients to whom clean intermittent catheterization was initiated regained spontaneous micturition. No spontaneous micturition was observed after 1 year. Thank you for your attention.